everyone, and welcome back for another deep dive. Today, we're going to be tackling something that's called broken wrist syndrome in autism.
Oh.
And now, before you start picturing a bunch of kids in casts, let me assure you that it's not about actual broken bones.
Okay.
We're looking at excerpts from a document, and it's called, well, Broken Wrist Syndrome, Autism.pdf. Very creatively titled. But it's actually a fascinating look at how some autistic kids can experience challenges with their fine motor skills.
Yeah, you're right. The name can be a little misleading.
Yeah.
It's more of an informal term that's sometimes used to refer to joint laxity or hypermobility in the wrist.
So basically loosey-goosey wrists.
Oh.
I mean, I'm no doctor, but that doesn't sound great for, like, trying to hold a pencil or tie your shoes.
Exactly. And it's about weak wrist muscles and ligaments, which can make those everyday tasks that require fine motor control, things that we often take for granted.
Yeah.
Quite difficult.
Okay, so this isn't just about kids being a little clumsy.
No.
It's like a real condition. And the document that we're looking at says it seems particularly common in autistic children.
Yeah.
Is there a reason for that? Like, is there a connection?
Well, while it's not exclusive to autism, it does appear more frequently in neurodivergent kids.
Okay.
One theory is that it might be related to differences in muscle tone.
Okay.
Or how connective tissue develops in some autistic individuals.
So not every autistic child will have this, but there's a higher chance.
Yes.
That makes sense. But honestly, I wouldn't even know what to look for. How would you spot this broken wrist syndrome in a kid?
Well, the document highlights some key signs.
Okay.
One is difficulty grasping objects.
Okay.
So you might see a child frequently dropping things.
Yeah.
Or struggling to hold onto a crayon, for example.
Yeah, I can see how that would be really frustrating for a kid. Anything else?
Another telltale sign is an awkward wrist posture.
Okay.
Especially when they're trying to write or use utensils. Instead of a straight wrist, it might be bent at an unusual angle.
I see.
And in some cases, children might even experience joint pain.
Okay, so those are some things to keep an eye out for.
Yeah.
Now let's get to the good stuff.
Yeah.
What can be done to help these kids? I'm sure our listeners, especially parents, are eager to know.
Absolutely. And the document stresses that seeking professional guidance is paramount.
Okay.
Consulting with a pediatrician or even better, an occupational therapist is crucial.
Okay.
They can properly assess the child and recommend a personalized plan.
So it's not a one-size-fits-all solution.
No.
Which makes sense. Every kid's different.
Exactly.
But are there some general strategies that parents can use at home?
Definitely.
Ah.
The document outlines several practical approaches.
Okay.
One of the most fundamental is good old-fashioned practice and repetition.
Makes sense. The more you use those muscles, the stronger they get.
Right.
But how do you get kids excited about practicing wrist movements?
That's where creativity comes in. The document suggests incorporating these exercises into fun activities.
Okay.
Think Play-Doh, threading beads, even finger painting, things that kids naturally enjoy doing.
So it's about sneaking in those exercises without them even realizing they're working those muscles.
Exactly.
I like it. What else did the document suggest?
Another important strategy is using adaptive tools. This involves modifying the environment to support the child's needs.
So like special equipment or something.
Exactly. The document mentions things like pencil grips that can make holding a writing utensil easier, or specialized utensils that make mealtimes less challenging.
Okay.
They even mention adaptive scissors.
Adaptive scissors. See, this is why we do these deep dives. Stuff I never would have thought of.
Right. These are just small examples, but they highlight how even seemingly minor adjustments can significantly impact a child's ability to participate in everyday activities.
And I'm guessing alongside those practical tools, there are specific exercises to help build wrist strength.
Absolutely.
Yeah.
The document provides examples like wrist curls with light weights, resistance band exercises, or even something as simple as squeezing a stress ball.
Oh, yeah.
Of course, it's always best to consult with an occupational therapist to determine the most appropriate exercises for each child.
That makes sense. It's like a personalized workout plan for their wrists.
Exactly.
And while we're on the topic of being active, there was a section in the document about Goalie.
Yes.
What's that all about?
Goalie is an app or program that's designed to help kids build motor skills, which is relevant here.
Okay.
It essentially gamifies fine motor exercises,
Uh-huh.
combining them with screen time management, which is a concern for many parents.
So instead of mindlessly swiping on their tablets,
Right.
kids are working on their dexterity while playing games.
Exactly.
That's a win-win.
It's all about finding creative and engaging ways to help these kids develop the skills they need.
Now, note the document also tackled some common questions about broken wrist syndrome. One that caught my eye was about why some autistic individuals engage in repetitive wrist movements.
Mhm.
What's the deal with that?
That's a great question. While the exact cause isn't fully understood, it's often seen as a form of self-stimulation
Okay.
or a way to cope with sensory overload.
Sensory overload. It's something we hear a lot about in the context of autism, but could you explain that a bit more for our listeners who might not be familiar?
Of course.
Mm,
Imagine being bombarded with sights, sounds, smells,
yeah.
and other sensory input all at once,
Mm-hmm.
to a much greater degree than what most people experience.
Okay.
That's sensory overload,
Yeah.
and it can be incredibly overwhelming for autistic individuals.
So these repetitive movements could be a way to manage that sensory input to kind of self-regulate.
Precisely.
Mm.
It can be a coping mechanism to help them deal with an environment that feels overwhelming to their senses.
Okay.
And it's important to remember that while the document focuses on broken wrist syndrome, autistic individuals' experiences are incredibly diverse, and these repetitive movements can manifest in many different ways.
That's a really important point. There's no one-size-fits-all when it comes to autism,
Exactly.
and understanding that diversity is crucial.
Absolutely. It's about recognizing and respecting individual differences.
Yeah.
And that's something we'll be exploring further as we continue this deep dive.
You know, as we were talking about sensory overload and those repetitive movements, I realized something.
Yeah.
The document we're looking at,
Mm-hmm.
it actually uses the term broken wrist syndrome to describe those movements sometimes too.
Oh, that's interesting.
Yeah.
It highlights one of the challenges with this topic.
Uh-huh.
The terminology can be a bit confusing.
So wait, are we talking about two different things here?
In a way, yes.
Okay.
The term broken wrist syndrome is sometimes used to describe the joint laxity and muscle weakness we've been discussing,
Right.
and other times it's used to refer to those repetitive wrist movements.
So it's like two separate things being called by the same name.
Exactly.
No wonder there's confusion.
And this underscores why clear communication is so crucial when discussing these complex issues.
Yeah, for sure.
We need to be on the same page about what we're actually referring to.
So just to be crystal clear for our listeners,
Right.
when we talk about broken wrist syndrome in this deep dive,
Mm-hmm.
we're specifically talking about the joint laxity and its impact on fine motor skills.
That's precisely.
Okay.
And it's important to remember that those repetitive wrist movements,
Yeah,
while they can be a characteristic of some autistic individuals,
right.
are a separate phenomenon.
Right. They're often seen as that self-stimulation or a way of dealing with sensory overload
Exactly.
we talked about.
And it serves as a reminder that autistic individuals' experiences are incredibly diverse,
For sure.
and there's no one-size-fits-all explanation for these behaviors.
Speaking of diverse experiences, the document also makes it clear that
Yeah.
while this broken wrist syndrome, as we're defining it, is more common in autistic children,
Yeah.
it's not a universal experience.
Absolutely.
Right.
Not every autistic child will have these challenges with their wrists.
Okay.
And that's why that individual assessment by a professional is so important.
It's about figuring out if a child is actually dealing with the specific issue
Yeah.
and then tailoring a plan to their unique needs.
Precisely.
And that plan might involve those strategies we discussed earlier,
Right.
like practice, adaptive tools, and targeted exercises.
Mm.
Or it might involve a completely different approach.
Exactly.
The key takeaway here is that there is support available,
Yeah.
and there are ways to help children thrive regardless of their individual challenge.
I couldn't agree more.
Yeah.
Sometimes just knowing that there's hope and that they're not alone can make a world of difference for families facing these challenges.
So true.
Yeah.
Now, as we're getting towards the end of our deep dive,
Okay.
I want to circle back to something we touched on earlier, the emotional impact of broken wrist syndrome.
That's a crucial aspect we can't overlook.
Right.
Imagine the frustration a child might feel when they constantly struggle with tasks that seem so easy for others.
Or the self-consciousness they might experience when they feel different or like they stand out.
That's why creating a supportive and understanding environment is so vital.
Yeah.
It's about celebrating their strengths, fostering their confidence, and letting them know that they're not alone in this journey.
It's about recognizing that their struggles don't define them and that they have so much potential to offer the world.
Beautifully put. And I think that leads us to a broader question that this deep dive has prompted for me.
Okay.
How can we as a society do a better job of understanding and supporting the diverse sensory and motor needs of all individuals?
That's a powerful question, and one that I hope our listeners will continue to think about long after this episode ends.
Because it's through that kind of thoughtful reflection and action
Yeah.
that we can truly create a more inclusive and equitable world for everyone.
I couldn't agree more. And on that note, I want to thank all of you for joining us on this deep dive into broken wrist syndrome.
It's been a fascinating exploration, and we hope you've gained some valuable insights along the way.
If this topic resonated with you, we encourage you to keep researching and learning.
Yes.
There's a wealth of information out there, and we've just scratched the surface here.
And remember, every individual's journey is unique.
Mm-hmm.
Let's embrace that diversity and create a world where everyone feels supported and empowered to thrive.
Beautifully said. And with that, we'll wrap up this episode of The Deep Dive. Until next time, keep exploring, keep learning, and keep diving deep.
Until next time.
It's amazing how much we've unpacked about broken wrist syndrome just from this one document.
Yeah, it really highlights how something...
Seemingly so simple, like wrist strength, can have such a ripple effect on a child's life.
Absolutely.
And how important it is to understand those connections, especially when it comes to autism.
Exactly. And speaking of connections, the document we're looking at repeatedly emphasized the importance of early intervention.
Oh, yeah, they weren't kidding about that, were they? It seemed like every other paragraph mentioned it.
And there's good reason for that emphasis. Addressing these fine motor challenges early on can truly make a world of difference.
Right.
It's about giving kids the tools and support they need to develop those essential skills.
Because imagine the impact on a child's self-esteem if they're constantly struggling with things that seem easy for everyone else.
Absolutely. It can be incredibly disheartening.
Yeah.
Early intervention is about fostering a sense of confidence and competence, allowing those kids to thrive.
So it's not just about fixing a physical issue, it's about supporting the whole child.
Exactly. And that's where those practical strategies we discussed.
Right.
The practice, the adaptive tools, the targeted exercises can be so valuable.
Right. It's like giving them a toolkit to help them navigate the world more successfully. And let's not forget the emotional support piece. I think sometimes we underestimate how much encouragement and understanding can impact a child.
Couldn't agree more. It's about creating a safe and nurturing environment where kids feel comfortable taking risks and trying new things, even if they stumble along the way.
Because let's be honest, learning anything new can be tough, but especially for kids who are facing additional challenges.
That's why approaching this with empathy and focusing on each child's individual needs is so crucial.
It's been a real eye-opener diving into this topic. I feel like I've learned so much, not just about broken wrist syndrome itself, but also about the broader challenges and triumphs that many autistic children and their families experience.
It's been an enlightening journey for me as well. And if there's one message I hope our listeners take away from this deep dive, it's that there is hope.
Yeah.
There are solutions. There are people who care.
And if you're a parent or caregiver who is concerned about a child's fine motor skills, don't hesitate to reach out for professional help. Ask questions, seek guidance, and remember you're not alone on this journey.
There's a whole community of support out there ready to help you and your child thrive.
And on that note, we'll bring this episode of The Deep Dive to a close. A huge thank you to all of our listeners for joining us on this fascinating exploration.
It's been a pleasure.
We hope you'll keep diving deep, keep learning, and keep exploring the world with curiosity and an open mind.
Until next time.